Andrew was going to add to the agenda for today. We do have Derwin Montgomery joining us at the last item on the agenda. He won't join until around 3:15 or so, so we'll look for that. Kathleen, if you'll just maybe let me know whenever he's joined.
Okay.
We can go ahead and kick off. Again, welcome to everybody. I think everybody's had hopefully a chance to review the minutes from the January meeting. I know I looked at those earlier. They looked good to me. I'll ask if there's any feedback that you could pass it along to Kathleen, but if we could get a motion and a second to approve these, unless there's any changes, I'll look for that motion.
I moved. It's Shane.
Second.
Okay. All right. Appreciate that. Any opposed? All right. We'll consider those approved as they are written. Appreciate your work on that, Kathleen, putting those together. All right. Well, Andrew, you've got pretty much the show today until Derwin is able to join us. So you had a system update. So I'll just hand it over to you and let you kind of walk through the items you've got.
I do, and then Laura and Sharika also have some updates. So I'll start with NCHMIS update. So for those of you who might be new to the commission, one of the responsibilities of the commission is annually to appoint the organization that will be our HMIS lead. And for the last several years, that's been the Michigan Coalition Against Domestic Violence, as it's governed by the North Carolina NCHMIS, whatever that stands for, North Carolina Homeless Management Information System. And Sharika and Laura and I sit on the governing board for that body. And it's been made up of 9 different COCs across the state. I just wanted to give people an update because there's some shifting in the makeup of who's participating in NCHMIS. So we received notice about a month ago that the Wake Continuum of Care, which is the second largest continuum in the group, is pulling out of our implementation. The impact of that means that the cost shares are going to shift. We don't have, which is why I'm giving you this update. We don't have final budget numbers, but it looks like our costs could go up anywhere from $3,000 to about $20,000. Some of that depends on the big shift would be if we include purchasing a data warehouse, which is something that we've been working towards. The data warehouse would allow us to integrate data from the 2 different HMIS systems, soon to be 3 different HMIS systems in North Carolina, but it would also allow us to use our data to participate in research. So right now, if anybody wants data from NCHMIS to use in research studies, and we get requests pretty frequently from university researchers, from state researchers, from national policy research folks, it's very hard for us to give the data in a secure way, and that's what the data warehouse would allow us to do. The other thing it would allow us to do, which I'm more excited about, is there's the potential that it would be easier for those of us who aren't in HMIS to use warehoused data to create some more local reports in an easier way than coming straight out of HMIS. So anyways, there'll be more as we get closer to finalizing the budget for the year and what's going to happen with that data warehousing project. I will bring more updates on it. So I don't know if folks have questions. I don't know that I have a tremendous number of answers, but.
You know where Wake is going? Are they going out on their own, or are they joining something else?
They are contracting with us. So there's 2 components to the HMIS. One is the software package, and the other one is who's helping all the agencies use the software package. So for NCHMIS, we use a software package called WellSky. And then Michigan helps us use the software package. Wake is switching software packages to a package called BitFocus. And they were one of the groups that put in an bid when we were looking for a new HMIS system in 2014. And we chose not to go with them for a number of reasons. So, I don't know if they're gonna, my guess is that they will build, that their COC lead will build up the capacity to support the agencies to use the software.
Are any other groups looking at doing something different? So cost could change over time.
Officially, I don't know of anybody. Unofficially, I think yes. So I think there's rumors of people looking at options. So the other sort of political change that hasn't yet played out in this is in 2013, the state ESG office, which distributes a tremendous amount of homeless dollars to communities, told all the COCs in the state that they only wanted one HMIS system in North Carolina. And at that point in time, there are 12 COCs, 11 of them were in the same HMIS system, and Mecklenburg had their own. So essentially they were telling Mecklenburg, you have to join the statewide system. And Mecklenburg did. And for about 18 months, we were all in one system. And then for lots of reasons, we divided into two systems. With Wake going with a different software, that will bring 3 systems back into the state. So unless the ESG office comes back and says, nope, you can't, you have to choose one of these 2, my guess is that Mecklenburg will want to start looking at the opportunity to run their own system. I could be wrong about that, but just based on history. And I think I've heard rumors that other people have been asking around. So I think the next probably 12 months are going to tell us whether or not we will be able to keep enough of a core to continue to have NCHMIS function as a collective database.
And if just to pull on that string a little bit, right, as a possibility, if that were to happen and you had several others, and so now the cost of maintaining this goes up for us, what types of contingency plans would we have?
So my recommendation is that we start looking at contingency plans. There's a couple of different options. One is we could leave NCHMIS and go to the NCCH database. There's some philosophical differences, and that's what caused the breakup, about how data is managed by the 2 different implementations in North Carolina. We could look at one of the services that MICA has offered, but nobody has taken them up on at this point because we're trying to stay together, is to have COCs individually contract with MICA for services. So we'd have our own WellSky contract, and then with Laura and the HMIS staff we have in the community, contract with MICA for support for them and for other services we may need to have a la carte. And then the other option would be to do what Wake did, which is put out an RFP, see what all the options are nationally, and then choose from that pool.
And I'm assuming, I don't remember, and I probably asked this before and I just can't recall, but I'm assuming as we share the cost across these other geographies that it's done on a basis based on population or something, so it's not an equal cost for all.
Correct.
For each.
So
okay.
I don't, Laura and Sharika, correct me if I'm wrong. We separate out the cost of MICA from the cost of the database, and we pay for the database based on how many homeless beds you have in your system. So based off of the the housing inventory chart, and spread the cost that way. And we spread the cost of MICA based on how many HMIS licenses your community has. And some of the rationale, each one of those formulas breaks out the cost share slightly differently. And the rationale was the bed count really is how much of the database you're using, and the number of licenses you have in your community is how much technical support we need from MICA.
And do I remember that we have an FTE that we pay for and get reimbursed from the other areas to help administer this database, or am I remembering that wrong?
So we have Laura, who's our local system administrator, who is not part of that cost share. And then we also have connected coordinated assessment. We have a staff person that helps, and that's not part of the cost share. There are 2 staff members at MICA that are dedicated to North Carolina primarily, and we have the HMIS project director at MICA that works with us. And then we also, MICA has a help desk, and they have specialists by area. So we have access to lots of different specialists through MICA. So one of the benefits.
Where does Jared go?
Oh, right. And we have Jared, who is the project manager for NCHMIS, and he works for NCHMIS, helping manage the governance of that system and how 9 COCs interact with the state and other vendors in the community.
Okay. So we don't have a disproportionate cost relative to others, is what I'm hearing. It's shared on a sort of a pro rata basis.
Mm-hmm.
Okay.
Yeah, my concern is if Mecklenburg is the next one to leave, assuming they leave at all, then Guilford and then Forsyth become the next 2 largest COCs in the implementation. And right now, Mecklenburg carries more than 50% of the cost because of how much bigger they are than everybody.
Yeah, just to put it in numbers, right now Mecklenburg carries about 152,000, whereas the city of Winston-Salem, we're only at $39,000. So that's the big difference from what we pay versus what Mecklenburg County pays.
Thank you, Sharika.
So I think what you said, Andrea, is we're at a point where we probably need to start thinking about contingency plans if something like that with Mecklenburg leaving were to happen. What should we consider? So maybe we can come back and talk more about that at another time. Okay. I'm assuming you're agreeing, Andrea. I didn't hear you, but
You're muted. You're muted, Andrea.
okay.
Did you mute me, Kathleen? I have had the worst time with online technology this week. Yes, I was agreeing.
Okay.
So we will put that
Great.
on the agenda. Probably not for March, but maybe April, just to give us enough time to pull stuff together.
Okay. Sounds good.
All
right.
And then
and then you're going to give an update on the street outreach.
Yep. So we are continuing to see very high numbers in our street outreach. We have at Wednesday's count, it was 253 folks continuing. So that's been steady for the last probably 6 months, between 230, 250. So it's not going down. It hasn't gone down even with the opening of overflow. So one of the things that I'm recommending as a continuum of care, we start looking at what additional services do we need to meet the needs of people who are sleeping out. You know, before the pandemic, not all, but most of the folks who were sleeping out were folks who either couldn't stay in one of our shelters or were choosing not to stay in one of our shelters. And at some points in the year, we may have some capacity where people would want to be in shelter but couldn't get in shelter. What I think we're seeing now is more people wanting to be in shelter and they're not able to get into shelter. So starting to ask questions about what is the shelter capacity that we have? Do we need more or different shelter capacity? Like, is the distribution of the type and kinds of beds we have the right ones for our community, particularly as we start looking coming out of the pandemic? I don't think the pandemic ends and we go back to what life looked like before in our street population. I think our new base is 250, unless we do something very specific to address that. And so partially I'm bringing that up for this group to begin sort of wrapping our heads around how we want to approach that question around street outreach. Shrika, I'm going to punt to you because I know you have some updates around street outreach you wanted to talk about too.
No, not about street outreach.
Oh, okay.
I think the only thing that we've discussed so far in the operating cabinet meetings, other meetings with other agencies, is the need for congregate shelter. Right now, our COC only has non-congregate shelter, so shelter that is dormitory style. A lot of our street population have high barriers, which makes it very hard for them to live in a congregate setting. So being able to change some of our shelter agencies into having non-congregate options to be able to serve more people who have those high barriers. Also making sure that we have low barrier shelter policies in place, housing first policies are being used so that we are not screening people out, but making sure that we're screening everyone in to provide everybody services. So those are the conversations that we've had so far, just creating ways to make more non-congregate options so that we can reach everyone that's in need right now.
Mm-hmm.
Oh, there is one thing on street outreach. You're right, Andrea. We're looking at providing mental health to our street outreach population. So the city of Winston-Salem, as well as some direct service providers such as ESR and City with Dwellings, we're working with a few different agencies that provide behavioral health services to see how it would look for them to provide those services on the streets, and to those who are currently looking for housing or who are currently newly moved into housing. So provide those mental health services on site on the streets, going out with the street outreach teams so that they have easier access to services. So that is one thing that we're working on this week and next week, meeting with United Health Centers and partners of behavioral health, just to see how that can look and when we can get that started. So that is something that is in the works right now for street outreach.
I thought there was something else. And that's really exciting because that's been one of, even pre-pandemic, being able to make the connection between folks who are sleeping out and mental health services and substance abuse services has been a huge barrier. So I think that's a really exciting move to try and, with partners coming into the community, work with others in the community to try and get more street outreach connected healthcare for folks.
Okay.
So
Appreciate that info from both of you.
yeah. And then Laura had a very quick update on the pit count.
Hi, everybody. Good afternoon, and thank you for the invitation. I was originally asked to report on the preliminary count for the 2022 point-in-time count, and I plan on providing that update. But as we entered the data review and correction phase of the project, it became clear that some community agencies were going to need more time than in past years. So I don't have those numbers ready for y'all. I think a combination of factors like a lot of new staff, a lot of new workload due to new funding is just having a strain on data collection and review processes internally. But I am working with agency staff, providing training and technical assistance as needed. And I do expect the preliminary totals to be available within a few weeks. And once that information is reviewed and confirmed, I will send out a quick preliminary counts report. The final and complete point-in-time count data is not due to HUD until May. Usually it takes a few months to compile. Both the point-in-time and the housing inventory chart all happen at the same time, and they need to be reviewed and compiled together because a lot of these data sort of interlocks. So that's the counting of the people and then the counting of the beds, and that's how we understand, point-in-time utilization rates and things like that. So it takes a couple of months, but this phase just took a little longer than usual. So if you have any questions about the process, I'm happy to answer any questions you may have.
You're thinking maybe next month or April before you've got that?
By next month, I definitely should have at least some preliminary counts for the total number of people in the different housing household types that are counted, and veteran and domestic violence counts that are included. And then as we continue to move through the data, because it's a large data set, that's when we start to dive into demographics and subpopulations, and that usually gets confirmed farther down and closer to the due date.
Okay, good. Well, appreciate your work on that.
Thank you.
Andrea, I think you had some
Yep.
other topics that you had wanted to
Yep.
maybe spend some
So
time on before.
Other updates, I was hoping to have some pretty charts for you, but the Excel spreadsheet was not lending itself to making charts. But I did want to give a little bit of update on what's happening with the isolation shelter. So we started providing isolation services from the COC in March of 2020. To date, we have served 218 people with that service. And we've had an average length of stay in isolation of 7.5 days. Up until January of this year, we were averaging 1 or 2 people at a time. There was occasional blips where we might have up to 10 folks at a time. And that all changed in January. So in beginning January, we started to see what I will assume is the Omicron surge. About to get to January 2022. December 31st. So we had 3 people come in on that date. And then between January 1st and the end of January, we had another almost 60 people come in. So for most of January and then into February, we had between 50 and 60 people in isolation. So at that, when we were just having 3 or 4 up to 10 folks, we were staffing that with a part-time contract for services. So if we had
You muted yourself again.
Somehow you muted right in the middle of that sentence.
Sorry. Just so you know, it's actually GoToMeeting that's muting me. I'm not touching it, I promise. Prior to January, if we had 3 or less people in the shelter, we just had staff come and check on them 6 times a day. If we had more than 3 people in the shelter, we had staff on site 12 hours a day. Some of that was we found out during that first year that if we had 1 or 2 people, they mostly stayed in their room and they weren't problematic, or they were problematic and we made them leave, and that wasn't an issue. When we had 3 or more folks at the hotel, they started having interactions with each other, and that caused more problems. So having staff there during the time that they were mostly awake helped nip that in the bud. In January, I upped the staffing levels to 1 staff member on site for every 20 people, because we just were having so many people come in at the time. And we also, the folks that came in were a lot sicker, so we've had about 4 of them, it looks like, had to be transported back from isolation into the hospital. And then some of them came back to us, some of them were able to find other places to go after the hospitalization.
You're muted,
You're
Andrew.
on mute.
I promise I'm not doing it. It's not me.
I cannot explain it. It's like the GoToMeeting gods have hated me all week. So we currently have 2 people in isolation, which is great. And hopefully we will keep this up for a long time. So we
Be down to that number, you mean?
Yes, we like to stay down at 2 or 0. We did try, when we saw the Omicron numbers starting to come in, we did try and find other places to be able to house people, because there were many days in January where we didn't think we'd have enough hotel rooms. Thankfully, there was 1 weekend where we doubled up people in rooms because they were coming from the same shelter. That turned out to be a very bad decision. So by Monday, we were able to separate them all into their own rooms. And then we never had to double up anybody again. And we just were able to work out with the hotel to take every room that emptied at that hotel, we took. So we didn't run out. And so we were very lucky at that point. So that's the isolation update, if folks have questions about that.
And we've extended the current contract with the county, right, until June?
Yep, we have a contract with the county through June.
Hopefully we're past the wave, as you called it, right? So
Yes.
it's good.
Yeah.
We'll take 2 over 60.
Yes, any day. So, and there is a subcommittee of shelter providers who are looking at recommending some policies and procedures for what sheltering people who test positive for COVID will be like once the state of emergency is lifted. So I don't know, they are meeting, I'm not part of the conversation. So, but hopefully in the next couple months, we'll start having reports from that subcommittee.
Okay.
And so the other special shelter that we're running right now is a family shelter. We had, through the coronavirus money, we had some money that we were able to create a process for families who were not able to get into the one primary family shelter. ESR also has a small number of family units in an apartment building. So most of the families wind up at Salvation Army. So as Salvation Army was full, we were able to work with them to take families and put them into a hotel. We had a limited amount of money. We took up to 25 families at our largest peak. We're now down to 23 families. Most of our attrition has been people leaving to go to Salvation Army. And that's one of the conditions of our being willing to put them in a hotel, is that when a bed opens for them, they have to move back to the shelter. We currently have 23 families. There's not been a lot of movement at Salvation Army for the last couple weeks. Based on the funding projections, we are projecting that we have roughly 45 days worth of funds to keep the folks we currently have in the hotel. We do have a case manager now working with them, and so he will be working with all of those families to kind of expedite their search for housing. So that will be, you will see as we talk with the affordable housing folks when Derwin comes, has been a huge challenge for us. We're still having a hard time finding open and available units. I do know we have at least one family in the shelter right now that has a unit that has been identified, but it failed inspection earlier this week. So we have to wait for the landlord to repair the property, and then the housing authority will need to re-inspect. And then we are looking at if we have families that are referred from street outreach because they've identified families that have been sleeping outside, we will look at the possibility of bringing them into the program if we have the resources to do it. Because what we really don't want is kids sleeping outside.
No.
So that's the update I have on the family shelter.
Maybe tying in with that with kind of sleeping outside. Anything new or anything to update on the encampments? Anything happening there?
Knock on wood, I haven't had many calls about encampments. We've had a couple, which often happens, where folks are sleeping in buildings that are being cleaned up for sale to help them move. There's been some concern about encampments close to downtown that we've had street outreach folks work with them on moving to less downtown-y spaces. But not a lot of the, we haven't really had many complaints about encampments right now. There has been some concerns about really aggressive panhandling, which is slightly different than the encampments, but my analysis is that as we see more people out on the streets, we're going to see more aggressive panhandling because there's more people doing it. And so watching, sort of paying attention to what's happening with the panhandling as well as encampments.
When you say aggressive, is that aggressive towards just the general public or aggressive towards others who are sort of competing for space? What?
So my understanding of what I'm hearing is it's a panhandlers being aggressive towards their person they're asking for money from.
Okay.
So as opposed, like, instead of just standing on the corner holding a sign and hoping somebody gives you money, more affirmative approaching of people. And sometimes those conversations become very aggressive in their language. So pre-pandemic, there was often concerns in the downtown area about panhandlers following people into businesses. I haven't been hearing that lately, which doesn't mean it's not happening. It just means I'm not hearing about it. But I have been hearing some about more people being approached more assertively by folks who are panhandling. But there's also just a lot more panhandlers right now.
Okay. Yeah. Thanks for clarifying that.
Yep. So those are all my updates until Derwin comes.
Derwin has joined us.
Oh, excellent.
Okay,
So
great. Welcome. Welcome, Derwin.
your timing was perfect.
Hello all. I'm actually trying to
So we appreciate you joining us today. We were hoping you could help us with an update on the commission, the Affordable Housing Commission. There's a lot of tie-in between what this group's trying to do and what that group's trying to accomplish. And so just thought it'd be worth having a good update and some conversation. So I'll turn it to you to take us wherever you want, Derwin.
Cool. Give me one quick second. I'm trying to pull up. We just did a recent report to council, and I was trying to pull up those notes back up.
Okay.
There we go. There we go. Well, first off, thank you all for having me, and I appreciate the opportunity to come in and share some of the work that the Affordable Housing Coalition has been doing, and even just for some, even a brief on what the Affordable Housing Coalition is, as it is a newer composition of a commission established by the City Council. And so I'll try to briefly give you some history and context, and then let you run up to exactly where we are and what work we're doing and facilitating at this time. Back in 2017 and 2016, 2017, the Winston-Salem City Council engaged in establishing a housing study. From that housing study, we found that we had major deficits in reference to housing stock on a wide spectrum, from home ownership opportunities to rental to that missing middle housing that we need to work a great deal on. From there, the work shifted towards, well, how do we address this issue? One of the ways and one of the strategies was the need to establish what has been deemed as the Affordable Housing Coalition to help steer the City Council and the city on their action towards alleviating issues associated with affordable housing. There are about three or four main objectives that Affordable Housing Coalition has, and was affirmed in December 2018, the actual creation of the Affordable Housing Coalition, and members began to be appointed in mid 2019 to serve on the committee itself. And the tasks are simple but complex. The more simple part of the work is to advise the council on how it uses housing related resources. So the Affordable Housing Commission coalition has the responsibility to advise the council in recommendations on how they use housing funds, whether it's bond related housing on projects, whether it's the housing plan that is approved and sent to HUD for approval. The Affordable Housing Coalition plays a role in giving thumbs up, thumbs down on that, or giving just advice. And it's all just like in many ways, it's just recommendations. The council has the ability to make whatever decision ultimately they want to, but it's simply advise the council in that space. Additionally, the council was very intentional in terms of the makeup, much like the Homeless Commission itself, in terms of the type of people desired to serve on the coalition. Individuals who have had experience developing affordable housing projects, as well as development community who've had a specific engagement in reference to working, the philanthropic community with the ability to help bring in resources that may be necessary to move us forward down that road, as well as individuals with real lived experiences related to struggling to access affordable housing, as well as transportation challenges associated with that. So the makeup of the body is diverse in that nature in terms of perspectives. And we've been working here more earnestly probably over the last year and a half. Lost a year, like so much things with COVID, but over the last year and a half, very much more around helping everyone get on the same page, particularly in terms of the pace of what's happening, what's going on in the community itself. When COVID hit, there was a pause in our work, but we did come to the council in September of 2020 to make an interim recommendation, just because of what we were seeing in the community at the time of the large constraints that were being impacted on housing, and how housing was being stretched hard within the community as a whole. And it was in reference to two big recommendations was around the city was to receive additional federal resources associated with COVID response, that the city needed to look at how they directed those resources toward alleviating the housing constraints. And the second one was more so of a policy recommendation to the council, which the council acted on and continues to act on in this time frame. And that policy recommendation was specifically associated with dealing with the accessory dwelling units. We recommended in September 2020 that the council revisit that ordinance. And essentially what the ADUs are, if you're unfamiliar, there was a lot of write-up in the paper here the last couple of weeks over that when the council moved forward with their decision. But essentially granny flats, they're the apartments over your garages in the backyard, those type of units. We made a recommendation to the council that needed to revise it because we felt that the way it was written was too restrictive, and that was one of the tools we needed to have in the toolbox as we move forward. That was just one area of a recommendation that we made, but then we moved to very much generous work on how do we build the infrastructure and the coalition necessary to address. And there have been two recommendations, well, two courses that have come up in this work for us and how we're moving forward. One is the work that the city can hold. Because it's very, very clear that dealing with affordable housing in our community is not something that the city of Winston-Salem as an entity is able to deal with by itself. But the city of Winston-Salem, all of our community has to take on responsibility. Our entire community has to play some role in what we're doing, as well as their responsibility at the county and federal level in terms of some of the policy recommendations that need to happen. So there's one course of work that Affordable Housing Coalition deals with strictly with what the city can do, and that deals with its policies, its resources. The other side is creating and building out that infrastructure that's necessary to help the city and the community as a whole work through putting together resources to hold accountable. And for that, we pulled in a consultant out of New Orleans who came in to help facilitate conversation and really walk us through some of the work that they did post-Katrina in terms of dealing with the housing crisis that they were facing. And essentially what that did was that helped us to see that they essentially established an entity that holds the work of moving the community as a whole forward, because one, as I mentioned, the city as a whole can't do this work by itself, and the city needs to be held accountable. So when the city's not going in the direction that it needs to, there needs to be some non-political, apolitical group that is able to say, hey, city, we think you should be going in this direction. And in New Orleans, this entity serves as that group. And they were able to pull together by being supported by a cross-section of their community, the philanthropic community, the business community, as well as housing advocates, as well as those who are in the actual development roles in the community. And what that was able to do is that created a seat at the table for them in the process to be able to help facilitate real dialogue and real conversation moving forward. And for us, after we went through that process, we've come to the place where we believe that some type of entity like that is needed in our community, because we have so many people working in what we see as very much siloed work with the need to address the huge issue associated with access to affordable housing and the number of units needing to be developed. So as I mentioned, there's this two-pronged approach that's being worked on. The work we're addressing directly with the city, and then that larger community. And that larger community one is one that's going to take a little bit more time and effort to stand up and work. The coalition is looked towards being able to have at the appropriate time where community can engage or we're calling a real housing summit, where all of those who are interested in issues around housing, affordability, and helping us move forward on that are able to come to the table to help us talk through what our plans look like, how we're addressing that, and what a group and an entity that may exist outside of city government can look like. In addition to that, on the city side, we've pushed for additional resources, staffing resources and support within city government to support housing programs and housing development. As such, currently there are, I believe, 3 positions that are currently being filled within city government now that are tied directly towards housing. There's a housing director program, there's a housing manager, and there's one other position that is tied, I believe, to housing in general to support the city's efforts in terms of addressing the housing needs within the community as a whole. And I see it was put up here for us. And for us, as we move forward in this work, there at the top of what I think you may have there as well for you, kind of centers on those areas that we're continuing to lean in to as we move forward currently in our work, which is the efforts of expanding affordable housing opportunities, engage supporters of advocates for affordable housing, coordinate and secure sustainable resources for affordable housing, and advise the council on the use of funds to support affordable housing and development. Those are the specific areas in which the commission was empowered to engage in its work. And as I was shared just with you all, as how we have worked over the last about year and a half more earnestly and actually engaging in that work. To bring forward a full housing plan. The end goal on the external work is to have a full housing plan that is presented to the city council for adoption. We envision that housing plan to be one that is fully incorporated with recommendations, not just of the coalition members, but of the community as a whole. And it is seen as truly a full spectrum housing plan, meaning dealing from individuals who are homeless to individuals who are in housing, but are struggling in terms of the ability to simply cover rents within their housing capacities, to individuals who are looking for home ownership opportunities. The housing plan that we plan to move forward would be fully engaged on that, and one that evaluates all of our systems as a whole. And I know one other piece that came out of some of our conversation was the fact that, particularly in the homeless arena, oftentimes housing is talked about separately than the larger issue of affordable housing. And so one of the things from the coalition's dialogue was the fact that even when we look at dealing with homelessness, that needs to be an integrated component of the dialogue and the conversation as we move forward with what we're looking to do and any recommendations that come out of the coalition as a whole. And I know that before I pause to see if there's some specific questions or areas for us to maybe touch on a little more. I know from our conversations of just evaluation that there is the city is evaluating its existing programs and spaces that it currently is doing work in, whether it's programs that the city currently has operating in space. I know that there's some evaluations going to be happening within the continuum of care and its operations, those things. So there's that work that's happening all together that is intended to influence how resources and systems work moving forward as a whole. So I know I said
that, Derwin. No, that's all really good. I'm curious, can you ballpark what the need is here in Forsyth County for affordable housing?
So from the affordable housing study, and then that data is a bit aged at this point in terms of the existing numbers. That told us that we have between 15 to 20,000 unit deficit over the next 10 years. And so we're probably in year 3 of that number when it was originally given. And that does not take into consideration COVID's impact. And so part of the coalition's conversation has been in the dialogue of needing resources to make sure that those numbers are revised to take into consideration how COVID has exacerbated those numbers and the demand and the need associated with those numbers. But that was the working number we had before COVID.
Okay.
And the majority of the demand, if I'm going off the top of my head, about 80% of that, if I recall properly, are units that are needed for individuals on the lower end of income. So that's talking about individuals that are 80% and below of area median income. A larger chunk of those needed for individuals that are at 30% and below, which is normally at that space where you see housing authority and those qualify for that. but the majority of that is that 80% below. We don't have enough low-income housing in the community, and that's in large part based on the study, because we have individuals who are again, pre-COVID, individuals who are making more money, who are in lower price units because there is not the availability of other units in the community. So you have this sandwich effect that continues to push down, and those at the lower end are the ones who are having the biggest effect on them, along with a lot of the other missing middle and a lot of other recommendations that came out of that. And that missing middle are the fact that we don't have the townhomes and the duplexes. We don't have those in abundance in our community that offer different access points for individuals in the community. And so the recommendations on what you build is recommended that we have to fill those gaps across the board. So it's not just one style of housing. It's not just apartments. It's not just single family housing, but it's across the board where we have to fill that gap in.
And it's a bit of a moving kind of target, right? Just all the dynamics, not just COVID, but inflation, I mean, housing costs in general, cost of construction, everything is up. So I won't be surprised if the need is also going to be up.
Yeah, and that's our working assumption, because we've not had that validated qualitatively for us yet.
Yeah. Well, that's very helpful information. Thank you, Derwin. Any question for Derwin from the group?
That's good work.
Good report.
So Derwin, I guess just thinking about future updates and just keeping us in sync with things as they happen. You have any thought on maybe a cadence of how often we should maybe look to hear an update just to stay in sync with the work that the coalition's doing in the city?
Yes, we have these annual reports that we do, but I think we need to be talking a lot more than annually in terms of that. And I think that there's going to be this natural place when we move to standing up this larger community-based space for everyone to be at the table, to be engaged in these ongoing conversations. So I think that that's going to be a natural space, but until we get there, I think that, probably at this point, maybe at the minimum quarterly conversations probably should maybe happening. But the expectation, I'm not trying to overcommit, because I gotta make sure I check in with folks at the city on it. But the intention is to have a housing summit here soon, which includes everyone in the partners, community folks in the community coming together to help start this broader conversation that is outside of what city government can do. And that space, I think there's going to be important for folks like yourselves and others around this table to be engaged in that, to help shape that dialogue and conversation moving forward. So outside of our formal dialogue with the coalition, I look to Andrea or whomever to see how someone on this side could be engaged in as that moves forward.
Okay. So Andrea, it sounds like maybe we can take that and but maybe on a quarterly basis or something close to that, we could think about trying to bring Derwin back or someone back to update us and keep us informed and make sure we can help on the other side.
Absolutely. And, if there's anything we can do, the pandemic has really radically changed what we're seeing in the demographics of homelessness, particularly as it comes to street homelessness and a lot of the unhoused population. So if there's any way that we can help or be useful, the Affordable Housing Coalition, because we really are seeing a lot of changes, and then also feeling the impact of what's happening right now around evictions.
Yeah. And if I may, just two things there. I think that is important in being able to give voice to the real experience there for folks. And so as council and others are getting into budget conversations for next year, there's been discussion around, how do they look to fund moving into the future, support with the evictions and eviction prevention. I think that's a big area to have dialogue and conversation around whether or not there are resources maintained there. And I think being able to show data on this is what happens if you don't. This is the impact if we don't do that. And then as well, in the sense on the policy side of it, I think that there are some things that may be well for the Homeless Coalition to take a look at in terms of policy that specifically addresses housing geared towards individuals that are homeless or experiencing homelessness. I think that there's some space there that there's probably need for some review and potential revision for that, because that creates again another tightening of what's offered. And I just throw out there essentially there are certain regulations that are less than 20 years old around shelters and the type of shelter spaces that can be stood up and their proximity. Within the last 12 years, there were ordinance passed around rooming houses and how rooming houses can exist. And for some communities, rooming houses created access for individuals who would not otherwise have access to housing. And there's some slumlords who, charge people excessive amounts in some of those, and that's a problem. But when those policies went into effect, I don't know whether or not we have truly assessed its impact on the housing availability and what that type of housing brought. And I think for this group, those two are ways that I think that if there were thoughts and review on those kind of policy pieces, that it would go a long way if your voice was engaged in that.
Okay. Yeah, we'd be happy to do that. I think the other thing, which you didn't touch on, but I think, bring to the Housing Coalition's attention, one of the trends that we're seeing coming out of the period of eviction moratoriums is skyrocketing rents, right? Not like 10, 20%, but 200-300% increases in rent. And many fewer landlords are willing to take vouchers, which means that all of the federal resources coming down as vouchers we're finding very hard to use because landlords just aren't accepting them at all.
Yeah.
And so that's adding to the sort of crisis at that lower end of the housing market. It's just people can't find units.
Yeah, and this is where I mentioned, and this is maybe areas again for, and maybe we need to, outside of the full conversation here at Affordable Housing Coalition, maybe Andrea, you and I need to have maybe a more than just quarterly maybe check-in, because there may be some space
Happy to
kind of create some more opportunities, because this is an issue that has been raised at the Affordable Housing Coalition, but we also acknowledge that at the city level, there's almost nothing that the city can do in reference to that, because it's a federal, it's a federal program, and at the state level, there is no law that protects source of income. And back in my long time ago, when I was in the State House, I introduced a bill to protect source of income that realtors and apartment associations didn't want to see at all, in large part because of the regulatory constraints associated with receiving vouchers. And the argument was, well, how do you create a streamlined process for the landlord so that they will receive the voucher? And the problem we have now is I can get the $1,800 a month rent without having to go through the inspection process. So why would I take the time, even if I still get $1,800, it's gonna more time and energy in order for me to receive that. And that's the problem that we got to figure out how to solve for in that.
So,
Okay.
yeah, I'll try and set something up with you more regularly so that we can stay in contact.
Yeah, because there may be some interim things that are not that we may be able just to see if there's some opportunities for support across.
Derwin, thanks again. I appreciate the information for this group. Any other question from the group for Derwin on this topic?
And Jim, if I may, just the last thing I'll say is that I do know for sure from the city side The Housing and General Government Committee is looking to engage a lot more and simply put the foot on the gas in some of the work they're doing. So kind of looking at that agenda, and maybe even Mayor Pro Tem Adams is chair of that committee, that they're looking even to the council to have, they're calling it a housing summit, but it's totally different than what I'm talking about. But essentially, they're looking to have a briefing essentially. There's a challenge on the council now with everyone understanding the housing issue itself. And so what they want to do is try to make sure baseline the entire council. So engaging there and making sure you're paying attention to some of those things, which I know you all are probably already well aware of, I think is a good place to.
Okay, great. Okay. Well, that really takes us through the agenda we had for today. I'll ask Kathleen or Andrew if there's anything else that we needed to bring to the group before we adjourn.
I do not have anything else. Sharika, do you have anything
All right.
else?
Okay, and I think our next meeting is the 17th of March. So thanks for sending those meeting planners, Kathleen. I got those on my calendar now. So, and the planning meetings in advance. So appreciate that. Well, thanks everyone again for joining. Thanks again, Derwin, for joining us. And we will talk again in about a month.
Sounds
good
great.
day.
Thank you, everyone.
Thank you all.